My dear friends, let us go to the third topic of nasal trauma, nasal septum fracture. So, nasal trauma can lead to nasal bone fracture, septal hematoma, and the third one is nasal septum fracture. Now, this fracture is of two types. It depends how the injury happened to the nose. What was the direction of impact? My dear friends, look at the picture number A. If the force is from front, it will lead to horizontal fracture. You see, septum is like this. If force is from front like this, it will do horizontal fracture. And if force from below like this, from below, the fracture will be vertical. So, the force from front will lead to horizontal fracture and force from below will lead to vertical fracture. Now let us see them individually. If force is from front, it will lead to horizontal fracture or Zarza wave fracture, MCQ. Zarza wave. Okay. Now look at this picture. The force is coming from the front and the mode of injury is the front injury and the fracture will be horizontal of the septal cartilage. Now, if force is from below like this, it will lead to vertical fracture or Chevalier fracture. Chevalier. That's the MCQ also, Chevalier fracture. Okay. So, this is the vertical fracture or Chevalier fracture and the injury is from below. Now, let us discuss the treatment of the nasal septum fracture reduction. The answer is what? Close reduction using Asch forceps, ESCH. This is the Asch forceps. Okay. So, my dear friends, this is Asch forceps. So, we know there are two forceps being used for the nasal trauma. The Walsham forceps is for the nasal bone fracture reduction and Asch forceps is the forceps used for septal fracture reduction. So guys, we have discussed three clinical entities related to nasal trauma: nasal bone fracture, number 2 the septal hematoma, and number 3 the nasal septum fracture. And don't forget, septum fracture of the nose is of two types. If the force from front, it will lead to horizontal or Zarza wave fracture, and force from below will lead to vertical or Chevalier fracture. Now, the next trauma after nasal trauma, the nasal bone is the most commonly fractured bone of face. The second most commonly fractured bone of face is zygomatic bone. And the zygomatic fracture, next topic, also called tripod fracture. This is the second most commonly fractured bone of face. Nasal bone number 1 and number 2 zygomatic bone. Where is the zygomatic bone? I think you know that. My dear friend, this is the zygomatic bone. This is the body of the zygomatic bone. It has got three processes. Okay, let me show you. It has three processes. You see, number 1 process makes the infraorbital margin.